These are good exercises and measurements after surgery, right? After you're done consolidating, after you're done lengthening, you're back at doing everything, you can test yourself out. What did I do before? And am I close to being the same after? If you're not, that's what you work on. Then you build strength on top of that, and you'll be just fine. You'll be doing everything you wanted to do before surgery, after. Okay. Now, we did hamstrings. Just to talk about the quads, which most of us don't have a length problem with, meaning they're not super tight, other than measuring, trying to grab hold of your leg right here, and what you're trying to do is maintain your hip in a straight, or your hips straight, and you want to try to get that heel to your butt. That's a good are my quads tight? And then you should feel it gently into the front, okay? The initial video that I did with the measurement that the doc's going to do, it's an exercise as well. So if I came over here and I had the stretch strap and I laid on my stomach and I pulled this direction, okay, this is a stretch to my quads. So this is a quad stretch exercise, okay? So that's one. The other part is, if you enjoy more of a kind of in this lunging position right here, same thing with the strap. Okay. You can get into a lunge position, okay? The hips backwards, and you can pull your leg up, okay? Pull your heel up towards your butt, and you're going to lean. And then this is where we're going to feel it, okay? So we're going to lean into this and get this kind of a feeling right here to stretch our quads. All right. Okay. Last thing is hip mobility. Hip mobility is also important. And let me show you kind of what I'm thinking. Our hips are rotating, right? So if I brought my hip up, rotation is what we're looking for, okay? A simple method of getting hip mobility, there's lots of other things to do, is you can do going back to the yoga thing, this is a pigeon, I think, or no, I don't think it's a couch stretch. Anyway, the names aren't important. I apologize. Bring your hip up, okay? Bend your knee, and then rotate. So now we're concentrating on our hip range of motion, okay? So you can stand here, and then all you have to do is drop down, okay? From this position to this position, we can go into a rotational type of motion right here, okay? So down, okay? Stretch and hold, okay? So if you want to increase the stretch in this position, lean forward, drop down, okay? We're trying to bring your chest to the table, okay? You can really make it as aggressive as you'd like, okay? An alternative, what we call a piriformis or hip stretch, you can lay down on the table or on bed or on the floor, cross your leg, and then you're going to pull the opposite side, okay? Just like this, from here to here, okay? That's the stretch position that you're trying to go with. Hold and relax, okay?